Yes, I do. Okay. So now I think we are recording.
Yep.
It says recorded in progress, so I guess we're doing it. So, um, Gregory and I, full disclosure to whoever's watching this, we go somewhat way back. We know each other mostly professionally. Um, and we went to the same coaching school, Lifestyle Prescriptions University. A little shout out for Lifestyle Prescriptions University. But we had never worked together officially. I know we've done some like fun kind of group things, but prior to what, last month, you had never been my client, correct?
Correct. It was like, yeah, that was last month was the first time.
Right, beautiful. So you're newbie to my hypnosis and you're new to IEMT. So um I guess I invited you to IEMT because I needed case study. So I thank you again for being a case study and you turned out to be a great one. So it was perfect.
Well, I greatly appreciate you inviting me because, the results were fantastic.
Excellent. So I know you wrote a very nice review, so I will share his review beneath this post somehow. But whatever you care to share as a little background, kind of a little bit about what your journey was with your issue. Now your issue was kind of unique. I think I proposed IEMT to you because we, being us and understanding how the mind body organ connection works, we had already discussed emotional contributing factors to this problem that you were having. So that's kind of how we put IEMT to play. We put it to play, not really expecting any health results so much as just
Absolutely.
emotional relief of kind of some of the things that were going on. But why don't you share a little bit about your journey and what worked and didn't work and kind of worked.
Yeah, absolutely. I mean, we do go way back, and through part of that journey of, lifestyle prescriptions is actually how Dr. Stefan actually became sort of a mentor and a friend. And I don't know why I waited as long as I did to reach out to him when I went through this, because he should have been my first phone call. However, I um, I am someone who I'm a Reiki master. I'm into energy healing, and I'm into, um, you know, really self work. And so the beginning of October 2023, I was away on a retreat and got up at midnight to actually go use the bathroom, go pee, and I couldn't. And so I had a flare up. We figured out later on that I had a bout with prostatitis. And this prostatitis was, from my point of view, pretty severe as far as I was in pain. Um, for the first several days, I pretty much was bedridden because I was working on myself. I was focused on, you know, clearing and so on and so forth. Um, and little bit by little bit, it was improving. And what eventually happened after about several weeks, is the regular symptoms of the prostatitis disappeared and I was left incontinent. So I was wearing a diaper every day, meaning as far as my bladder incontinence. Um, and so 24 hours a day. And that went on for about 7 months. And I was continuing to dig deeper and deeper and say, okay, what is this? Where's this? Why is it manifesting the way it is? And I I went against everything my gut told me, which I know there's a lot of people that, you know, recommended I go to the doctor right away. I went to the doctor and um, really kicked myself afterwards simply because he didn't even examine me or anything else. The first thing he said was, I don't think this is the prostate. I think it's uh, a urinary tract infection, and men don't get urinary tract infection, which I totally disagreed with. And then before it was over with, he tells me that I might have kidney cancer. So that escalated really quick. And
And
so
that was without actually
that was
examining you, right? That
without,
was like his
he
intro
didn't even
to,
listen to my heart
oh my God.
that point, and had already told me, well, you could have kidney cancer. I was looking for the exit at that point,
Mhm.
but he was waiting for my urine test to come back. And so when he got the urine test back and saw that it wasn't a urinary tract infection, um, then he decided to put me on a prescription of Flomax, uh, which I went on. Um, but like I said, the symptoms of the prostatitis, was pretty much cleared up and was gone. But I was then left with, the incontinence. So um, as I continued to try different supplements, I tried different approaches as far as, the healings that I was doing on myself, and having help from a couple of other mentors. uh, I finally got to the point where I was like, I need to just talk to Dr. Stefan, because I've done everything I know to do. And, I just want to get his opinion. Is there something that I'm missing, or is there something he can do? And the three of us, and Dr. Stefan and myself, sat down and had a conversation. And it was you that picked up on something was off with my eye movement. And that caught me completely out of nowhere, because I just, that would have never occurred to me. But when you brought that up, or when you recognized that, you told me that I looked like someone who was actually under hypnosis.
Mm,
And Dr. Stefan added to that at that point, that said, well, the other thing is, the symptoms that you're having at this point are not the symptoms of prostatitis. It's the opposite. And so, you know, I was still working on the prostate. I was still working on the
mm,
bladder. I was still working on, those internal organs. Um, and so that's what led us up to, let's do hypnosis and find out what's going on there. And so that first appointment was hypnosis, followed by a full alignment, a chiropractic alignment. Um, and to my great surprise, and certainly celebration, within 24 hours, I had 75% improvement. And, the incontinence had shifted to where it was only a time frame of about midnight to 3 a.m. But during the day, I was fine. And so I followed up to let you guys know what was going on. And I think that's when you actually invited me, as far as the IEMT, to say, let's see what else. And I'll say, when, the thing that kind of surprised me, because I hadn't done hypnosis before, is we never talked anything about any of the physical issue whatsoever, or the symptom that I was having. It we zeroed in on emotion immediately. And then, of course, the first session with the IEMT, uh again, it was just focusing on what I was experiencing, which was some anxiety. I was um feeling feelings of rejection. I was having feelings of um, like somewhat fear, insecurities that I had no idea where they were coming from, was coming up. So I knew there was a whole lot of self-healing that was taking place, but these were old emotional hurts that I thought, we're done with, because I've done the work. I've worked, deep on so much of this stuff. Um, And you did that first IEMT session, and within 24 hours, every bit of my symptom was gone. And it blew my mind. I mean, sitting in the office, I mean, okay, I'm a good patient because, I expect results and things like that. But that there was no way I could have expected the kind of result that I got. And, you know, I mean, I thought, okay, well, this is really cool. We'll see what happens. Um, and then, 24 hours later, I'm like celebrating. Oh my God, this
Right.
this is absolutely incredible. Yeah.
It is
So yeah.
interesting because we
Oh,
really didn't, you were very content free, like, which is something that people have been appreciating about IMT is how things that are embarrassing and hard to talk about, traumatic or old things from the past that you think is resolved can sometimes be emotional for people. And um, I think Dr. Stefani even asked me, he's like, what did you guys work on? I was like, I don't know. Like, because I don't know. Like I know the topic and I know that
right.
we went through those layers to get to those, okay, like when did I feel like this before? Oh, okay. Back then that seems random, but it's not. But you really kept it um minimal in how much feedback you gave, which is what we want. We're not here to talk about the issue. If talking about the issue fixed the issue, you would have fixed it 8 months prior, right? Like
Right.
instead, we just worked on those kind of real-time feelings and we went back to when do you remember feeling this way? So I
And
don't think
and
either one of us expected the result that we got per se, but that was amazing.
but I think my training came in as far as um being able to cut through the story, and you were asking me, what are you feeling? And I think that was the very, like, that's the highlight of what got us there so quickly. Is I went straight for what I was feeling. And there were days that I was actually feeling what I thought was almost like PTSD. It was like when this emotion, this wave of emotion would hit me, it would hit me in the diaphragm and I would feel sick to the stomach, and not to the point that, I go hide in a closet or anything, but it was more than just, I don't feel good today or something like that. This was raw emotion that was really hitting a nerve. And I was able to kind of narrow it down and say, well, these seem to be the things that I'm experiencing the most. And then you took it from there and drilled right in. And I mean, you know, and it's not like I almost thought, okay, well, there are going to be tears, there are going to be, that was going to almost relive some of this or whatever. But that wasn't the case. It was identify it, let's dig down and see where this, first showed up or whatever. And then what, I mean, my terminology would be diffuse it, release it, or whatever. Um, and boom, little did I know that that work was then going to, just change everything. So, and then I was really kicking myself as to why did I wait 7 months, you know? I mean, it certainly won't happen. The other thing is, I've always been a very healthy person. This is the first major medical crisis that I've had, I would say, in my life, other than tonsillitis,
Hmm.
you know? And and so it was definitely an eye opener, but I know who I've got on speed dial now.
I like that. I like that.
Yeah.
Well, it's like sometimes those of us who do this type of work where sometimes it takes a while, but it's like that timing is perfect because you don't know, all and that was part of our process too, is all the positive things that happen since a negative event kind of change your perspective when you look at that timeline to see like I could have
absolutely.
done this one way, but I didn't, and it's okay. Like I did
Well,
it a
yeah,
different way.
it's all the things I learned along the way, certainly.
Hmm.
And now, it's like, I guess everybody's tired of hearing that story. They're like, everybody knows who Rose is, that's for sure. Well, Rose helped me call Rose. So yeah.
I love that. Thank you. So, if someone is watching this who doesn't already know you and me, and what advice do you have for somebody who might be watching this, who might be curious about IEMT and could it help them? What do you have to share about your experience with it compared to other modalities, or who do you recommend it for, or what could you share for someone who's like, what is this crazy girl with her eye movement technique doing?
Um, there is no way anybody would have convinced me that an incontinence issue was going to be corrected by doing an eye therapy session. And the combination of the three things that we did, the hypnosis, the alignment, and then the IEMT, completely corrected everything. And so it's not a situation where, you know, I would say if you've tried several things, especially, I mean, whenever it's in alternative treatments or alternative approaches whatsoever, we're always the last ones they call anyway. It's when you're desperate.
So true.
But do it before you get desperate. I
Mm.
even waited until I was desperate, you know? And although I was doing all the other things, um, but this is something that if you're frustrated and you're not getting the result that, you feel like you should, I mean, it's certainly not going to hurt. And to give me the results that it gave me in as short of a time as it gave me, I would have them lined out the door for you. And I tell Dr. Stefan that on a regular basis. I don't understand why there's not a line completely around the building. I do understand. However, it's like, um, this is something that blew me completely off my feet as far as to get the results as quickly and effectively as we did. And I think it's been 3 weeks, probably 4 weeks, maybe it's been a month since the last session that we did. And, my health continues to, get better and so on. And I mean, I'm just, thankful every day for it. So thank you.
Beautiful. You are so welcome. And you're a wonderful, I think, testimonial. Just in case anyone is watching this who doesn't know us, I didn't do the chiropractic adjustment.
No, no, no.
It would not be successful. But it's a beautiful testimonial, I think, for our whole clinic to show how we do work. It's an integrative clinic. You've got multiple heads for who it doesn't matter what practitioner you're seeing, whether you're here for chiropractic, functional medicine, you're here for the emotional work, you're here for massage. Like we collaborate, we work together, and we kind of cycle you through however we think you should be, that would be best for you, physically, mentally, financially. And I think the IMT is just a great tool in all of our toolbox now because it's to me, it's such a time saver for clients. I mean, look at you, what we
Yeah,
achieved in 3 hours of your time, 3 sessions, one
yeah.
hypnosis, two IMT would have probably taken me much longer with hypnosis. It just there
Yeah.
was too many facets for me to explore. And now we kind of so it's a wonderful story about kind of what can happen for people when we kind of put all those talents into one day, right? Because you did
Yeah.
chiropractic and hypnosis the same day, and then you came back for IMT. I think you
Yeah.
also had another adjustment the same day you did IMT. So it's a
Well, but
one-stop
that
shop.
wasn't, that was the last IMT. That was the second
Oh,
IMT. So that the first IMT, got to the root of whatever that last little bit that was hanging on.
Mm-hmm.
So, it was just the IMT and that was it.
Wonderful.
Um, but, even the entire practice, first of all, um, I think even with chiropractic, people think, oh, well, there's nothing wrong with my back. There's nothing wrong with my spine. You have no idea what effect it has on the rest of your body. But the emotional part of it, when you know that 90% of, the symptoms that you're having are emotionally connected, and this hit the bullseye right away, then my body was able to do what it needed to do and say, oh, I don't need this symptom anymore. That's how I look at it. And so, yeah, I would have everybody lined up. And
Beautiful.
I I have recommended them from Atlanta, from Florida, from California, and DC already. So, your phone's going to be ringing off the hook.
Well, thank you very much. Thank you for your time and sharing your feedback because I do want people to know about this amazing modality. And I really appreciate you sharing your story with us.
Absolutely. And thank you for all you do. I mean, I am eternally grateful for, the outcome that we have in restoring my health. So, absolutely.
All right. I'm gonna